Dr. Kuykendall, can you discuss any specific interventions or educational tools that have proven effective in improving symptom management and disease progression awareness for patients facing PV, myelofibrosis, and/or essential thrombocythemia?
Yeah, so I think when we're talking about symptom management, disease progression awareness, one of the things I think is very helpful is to have a expert or specialist in your corner. And that doesn't mean that's the person you're seeing every month or every 2 months or every 3 months. It means you've seen them one time at least, right? And you've been able to sit down and ask every question you have. It is very important as medicine gets very, very specialized. Um, just the amount of information that's out there on every single one of these disease states is impossible to keep up with if you're a generalist. If you're treating everything, you just can't be completely up to date on everything that's going on in myeloproliferative neoplasms when you've got a colon cancer patient, a breast cancer patient, a pancreatic cancer patient, an anemic patient, coming into your clinic. And so having that specialist in your corner really gives you that resource of asking some of these challenging questions. And I think that more than specific medications, I think what a specialist can provide is that education and that lifeline. So beyond having that specialist in your corner, I think that it's also helpful to have a network of kind of colleagues or patients that you have as a support group or as a resource group to bounce things off of. And so there's a number of patient networks, whether it's patient empowerment networks or MPN Advocacy and Education International or Facebook groups or whatever it is, right? There's a lot of different resources where patients can reach out and touch base with other patients or look for programs, educational awareness programs that are out there and really become an advocate for themselves and really drive their own care. So when we're talking about interventions, educational tools for symptom management, disease awareness, I would say seek out and have a specialist that you see at least one time that you can reach out to with any questions, and also build a network of some sort of patient group where you can access real-time education and resources, and also talk with other patients about their experiences.
Okay, thank you. So you mentioned having a specialist, and I also have a specialist for my particular blood cancer. I live in an area where we don't have a multiple myeloma specialist, so I've had to go out of state for that. So one of my biggest fears when I did that, I have a very good oncologist locally. I did not want to offend him if I said I wanted to go seek out an expert opinion. Do you have any suggestions for patients who might be afraid to mention that to their community oncologist if they're seeing a community oncologist?
The first thing I'd say is that there's probably nothing to be scared of. I think that community oncologists generally understand what specialists are there for. Honestly, it takes a bit of weight off their plate if we spend, an hour and a half with our patients talking about everything that comes with a diagnosis of myeloproliferative neoplasms. I think that's time that they can spend on other things in their clinic, and they usually have very busy clinic schedules. And at the same time, I think this is usually a kind of symbiotic or mutualistic relationship where both people involved or both physicians involved can really play a role and benefit the other. So, I'm in Florida, and this is a big state, right? For me to get to Key West is going to take a while. For me to get to Tallahassee is going to take a while. Miami is a long way away, but I have patients from Key West and Tallahassee and Miami, and now with virtual medicine, we could do a little bit more virtual, but it still doesn't replace the seeing the patient in person. And so I would say 80 to 90% of my patients have a community oncologist they see that has my cell phone number or my email address, and is encouraged to reach out to me with any questions, concerns, thoughts. And when we see patients and we come up with treatment plans, I'm usually kind of reaching out to their community oncologist to say, hey, this is what we're trying to execute. This is the plan. Do you want us to help with that? Are you able to take it? Let's work on this together. And so typically this isn't something to worry a lot about. If you really are concerned, I think one way is say, hey, I'd like to see a specialist to talk about clinical trials. And honestly, that's one of the things that community oncologists are like, oh, okay, absolutely. Like that's a great reason to see them. The two most common reasons for a community oncologist to refer someone to an academic center is probably clinical trials or discussion of transplant, right? And so You could say, hey, I want to talk about transplant, or I want to talk about clinical trials, and typically that'll be a good reason to get in the door. So yeah, my activation tip for this is I think there's a distinct roles for community oncologists and specialists, and really this should be something that works really well together.